I'm Lois. I had an ACL reconstruction and a meniscus repair. So I was out running with a friend and I slipped sideways on wet ground and I felt a pop and I thought something wasn't quite right with it. And then I'd had an MRI scan at Clifton Park Hospital, which revealed I'd torn my ACL and I wasn't sure what else, but apparently my meniscus was pretty bad as well. My consultant was Dr. Nagy. He was really friendly, approachable, made me feel really at ease, and I felt he was really good at what he did. Oh, I was so anxious before even meeting him about what surgery was going to be, how long it would take to recover, and he just put my mind at rest straight away, really friendly. He just was really thorough about explaining the procedure to me and yeah, made me feel really kind of relaxed about it. So I felt confident that he knew definitely really well what he was doing. Good experience.
So my name is Mr. Mathias Nagy and I'm a consultant orthopaedic surgeon based in York. As a consultant orthopaedic surgeon, I focus on the treatment of sports injuries in young adult patients. And my aim is to give my patients a stable and pain-free knee for life and for sport and try to sort out the problems as quick as possible. So having fast access to diagnostics such as an MRI scan is crucial. So it's possible for a patient to come to me in the morning, have the MRI scan the same day, that we can make a diagnosis and a treatment plan on the same day. And it's really essential because we can get to the bottom of the problem very quickly, diagnose some additional injuries which might not apparent on clinical examination, and then provide a treatment or just reassure patient and give them a peace of mind, and then initiate then the rehabilitation or treatment as soon as possible. This certainly translates then into a quick recovery or a quicker rehabilitation and return to sport, return to work, and patients are then able to continue with life.
Before surgery, I was very active, very sporty. Obviously, my job as a firefighter is very active anyway, so it was quite difficult to then not be able to do that. Initially, when I'd done the accident, I was referred to my local GP just in Helmsley, and then they put me through to Clifton Park at York, and I was fortunate enough to get Dr. Nagy as my consultant.
As a soft tissue knee surgeon, as a sports knee surgeon, I use MRI scans quite often, and we have one of the best scanners here in the region. And it's not just about the scanner itself, it's about the whole team and the whole environment. We have top-trained radiographers, but also equipment, so additional equipment as a coil for the scans for the extremities, and also a group of MSK radiologists who are subspecialists looking into sports injuries, joints, tendons, ligaments, and it makes really a huge difference that we have this as a team available here. I think it's essential to have early diagnosis, and the diagnosis is based on imaging, but also examination and history. And having this done very early enables us to plan the treatment and pick up some additional injuries. During a long waiting time for an MRI scan, patients might have some additional injuries, and we see this quite often when they are waiting a long time for diagnostics and an operation, that they get some additional cartilage or meniscal injuries. So early treatment is key.
I would say it's completely normal to feel anxious and a little bit worried. Before the surgery, I was very, very much anxious myself. Meeting the team, I felt so much better about it. It gives you a better quality of life in the long term, and I think, don't worry about it, meet the team, you'll realise that it's definitely worth it. So initially I was in a fixed leg brace for 2 weeks, and then I went to meet up with Alex from the physio team at Clifton Park Hospital. They were really good, explained everything really well. I'm going to be with them for around 6 to 9 months. Every 2 weeks I just get a few more stretches, a few more movements, and already it's become so much more flexible. Just really great, yeah. So this is the flexible brace. This one's around 4 to 6 weeks, just to get you kind of mobile again. It just means that it's set at 120 degrees, and I think every few weeks it'll get changed a little bit just to move my knee a little bit more, make it more flexible, and just build up the muscle so it's not putting so much weight on where I had the surgery. It's already so much less painful than it was before. I already feel much more mobile, and it just feels like it's going to be so much stronger, and I just can't wait to get back to work and use my knee properly again.